Hello all, very good morning. So in today's topic, I would like to continue the job descriptions of community health nursing personnel. So here we'll mainly discuss, there are different categories of workers who are working in the community setting. So we'll see one by one. So coming to the job description of a female health worker who is called as ANM. So according to this National Health Mission, the health worker, NHM health worker, female, she is called as auxiliary nurse midwife. So she is responsible for the health promotion. She is responsible for disease prevention. At the same time, she is the one who is responsible for delivering the prescribed treatment and assign the rehabilitative tasks. So what she does is she holds different types of responsibilities, mainly to achieve the goals which were related to the national health program. So the government of India or the state governments, what they have done, they have created lots and lots of health programs. So in order to achieve those health programs, in order to achieve those goals, she holds different types of responsibilities to work. So she is responsible for working in different settings, such as different programs like maternal and child health, family planning, medical termination of pregnancy, nutrition, universal program on immunization, and communicable diseases such as leprosy or malaria, or endemic areas with filaria fever or Kala Azar, or endemic areas such as dengue or chikungunya or Japanese encephalitis. So she is responsible for these type of activities. So she what she does means she mainly helps, she plays a crucial role in achieving the national health program. So here her job, it including the working in control program of non-communicable diseases and collection and reporting of vital events, and she also acts as a record keeper. She also treats the minor elements. She also participates in team activities. She goes for house to house visits. She also participates in the surveys, and she acts as a facilitator of accredited social health activists, nothing but ASHA. So these are all the responsibilities. These are all the responsibilities which were taken by these ANMs in the treatment setting. Coming to the maternal and child health related responsibilities. So here she acts as she is mainly responsible for the early identification and registration of the pregnant mothers. So she has to guide those mothers for the antenatal visits. At least 4 antenatal visits must be done during their antenatal period. And nextly, provision of care during the antenatal care. Means during the antenatal period, she is the one who is responsible to take care of those mothers, and she also should participate, means testing the antenatal mothers for urine, albumin and sugar and blood hemoglobin levels. So if there is any problem with the albumin or sugar levels or hemoglobin, she has to give treatment for those. So it is very common that the mothers will get gestational diabetes or gestational hypertension. So during this time, during the antenatal period, the ANM nurse a crucial role, and she must refer the antenatal mothers to PHC or community health centers for testing the blood for grouping and RPR test for syphilis. She refers the abnormal cases of antenatal with medical problems to the primary healthcare center, and she also conducts the deliveries in sub-center or at home depending upon the condition of the mother, and she supervises the deliveries that were conducted by the dayas and assists them whenever they call for, and she is also referring the cases. What are all the complicated cases that were present in the community setting, she is referring those cases for the hospital, and she is referring the newborns with abnormalities to the institutional care. As we are discussing, she acts in a different role, means so many major roles. What are all the health programs that were there in the community which were given by the central government, like this Janani Yojana scheme, Janani Surakshana Yojana scheme. So she only formulates, she carries out and formulate to help for the distribution of money under this Janani Surakshana Yojana scheme. And nextly, she also conducts the weekly or fortnightly meetings with all the ASHA workers in the area to guide them and to monitor them. And this ANM, what she does is she go for the postnatal visits. So the mothers who are delivered at home, So at the day 0, at day 3, at day 7 and at the day 42nd, she goes to the mothers who got delivery at home and she visit them. And she also visit the postnatal mothers on day 3, day 7, day 42, those who got deliveries at the institutional level. If the mother has delivered at home setting, she go and visit them at day 0, day 3rd, day 7 and day 42. If they are giving birth at institutional level, she go at day 3rd, day 7th and day 42nd, and she provides, she advises on care of mother and care of feeding baby of the newborn. And she is very accountable to make 6 postnatal visits and to check the birth weight of the babies mainly on day 0, day 3rd, day 7, day 14 and day 21 respectively. And she should screen for any kind of congenital abnormalities and she should provide appropriate referral. And she is the one who is responsible to motivate the mothers to initiate the early breastfeeding. So here early breastfeeding is very must and should, because the mothers produce the colostrum, which is very essential for the baby's immune system for boosting their immunity. So within an hour of birth, the mother should give the first breast milk to the baby, and they should start at least after 6 months. They should start the weaning foods, and she should, and as a ANM nurse, she should monitor the growth and development of under 5 children, and she should make necessary referral if any baby is not feeling well, if any baby is having any kind of congenital abnormalities or any developmental issues, she should give the necessary referral. And she should provide, as we are discussing, minor treatment or minor elements were mainly done in the community setting itself. So any kind of diarrhea or respiratory problems or minor elements, if she can treat, she has to treat. If she cannot treat, she has to refer the cases as per the guidelines. And she should health educate the mothers on the, as a nurse, she should health educate the mothers on maternal, child health and family planning, nutrition, immunization, control of communicable diseases and personal and environmental hygiene. And she should assist in conducting the antenatal and postnatal clinics at the sub-center level. So these are all some of the responsibilities which were like maternal and child related responsibilities with the ANM. Coming to the family planning related job responsibilities. So she maintains the eligible couple and the child register. She goes for the family planning program. She motivates the couple for family planning. Because of that only we are seeing a lot of increased family planning procedures. So all the eligible couples, those who got children according to the government policy, those couples has to go for the family planning. She should distribute the oral contraceptives to the couples and she should extend the necessary help. So as a community health nurse, you are responsible for this family planning thing. So temporary family planning methods such as using the oral contraceptives or making the family members to accept for these family planning services. And she should help the dayas or ASHA workers to accompany them to hospital, and she should provide follow-up services to the female family planning acceptors. So how she can provide means insertion of intrauterine devices, nothing but copper T wire at sub-center level. She should help them in training and depot holders for the conventional, and she should establish a rapport with the acceptors, with village leaders, with ASHA workers, with dayas and others, and utilize them for promoting the family welfare program. And she should identify the women leaders and she should train them, because those women leaders, they are more influential and they are more good at motivating the community female persons. So she should make them as a health assistant female worker, and she should participate in Mahila Mandal meetings, and she should use the opportunity mainly for educating the women in family welfare programs. So these are all some of the job related responsibilities for this family planning for an ANM nurse. Coming to the medical termination of pregnancies. So what are all the responsibilities means? She should create an awareness. So what is the risk for consanguineous marriages, what is unsafe abortion. So she should inform them what are all the available services that are provided by the government. She should identify the women those who are requiring help for this medical termination of pregnancy, and she should refer them for the nearest approved institution. So these are all some of the points here. Coming to the nutrition related responsibilities, so she should, as a community health nurse, she should identify the low birth weight as well as malnourished children or young children who are mainly at the age group of 0 to 5 years, and she should refer them to the primary health care centers. And the administration of iron folic acid tablets for the pregnant mothers, and nursing the mothers as well as adults and girls, and the syrups to the young children. So she should follow the guidelines, and she should make them to take these medications. And administration of vitamin A in case of decreased vitamin A levels in the children. And she should health educate the community about nutrition, diet, and she should coordinate with the Anganwadi workers. Coming to the responsibilities at universal program of immunization. So here mainly she should focus on the pregnant mother, she should focus on the under 5 children, because these people are more prone to get the infection. So immunization of pregnant mothers with the tetanus toxoid, immunization of infants and children against this diphtheria, DPT vaccine, pertussis, tetanus, measles vaccine, TB, poliomyelitis, hepatitis, meningitis. So as you all know the immunization schedule, it is your responsibility to motivate them. So those who are at need of these vaccines, it is your responsibility to motivate and to make them take these vaccines, recording and reporting all the adverse event following the immunization. So these are all some of the responsibilities. So she should submit the monthly reports of universal immunization program, and weekly reports of any epidemic should be reported immediately. So if she find any kind of communicable disease, so there as a controller, the health board, she should inform to the health board, so they will take the necessary measures so that the disease cannot be spread from the community, other communities, so that it cannot create any kind of epidemic or pandemic. Nextly, cold chain maintenance of vaccines. So she should outreach the immunization and safe disposal of waste that was generated during the immunization. She should follow the guidelines and she should discard them. And preparation of expected beneficiaries list. So she should identify who are all the beneficiaries, who are all should receive so and so particular treatment or particular scheduled treatment or some program treatment. So she should help the Anganwadi workers, she should work the ASHA workers, and she should ensure that the vaccination is done adequately and mobilization of vaccine is done adequately. Because if the mobilization of vaccine was not done in a proper manner, the vaccine won't reach the society, the vaccine won't reach the community, so that the people who are living in the community, they won't get proper vaccination, and it will result in spreading of the disease. So the people are ultimately going at risk for the disease. So in order to eliminate all those kind of things, she should prepare the expected beneficiaries list, and she should give it to the Anganwadi workers and ASHA workers so that no person will miss. She should track out the immunization dropouts. She should go for surveillance and reporting of vaccine association problems with poliomyelitis, and she should indicate the vaccines and logistics weekly. So what is the beneficiary list, how many people has received and how many people still need to be received, and what is the amount of vaccine that was needed. She should display everything. She should indent everything and display the time schedule for sub-centers that consists of name of village, venue, date and time of immunization session, and she should also indicate the names of ASHA workers and Anganwadi workers, so that when you are displaying properly, if the advertisement is gone properly to the public, so that they can come there and they can take out the immunization. She should do the posters and paintings. Mainly she should display key messages. What is the positioning during the vaccine administration? What are all the safe injection practices? What is the vaccine viral monitor? And she should display it all in all the sub-centers so that they will have some knowledge. Coming to the role and responsibilities in communicable diseases, so she should notify. So if there is any occurrence of diarrhea or fever with rigors or etc., she should notify it to the medical officer. She should involve HIV or sexually transmitted infections counseling, she should engage them. So she should engage them in HIV or sexually transmitted infection screening. So coming to the leprosy related job responsibilities, she should health educate the community on leprosy and availability of treatment. She should refer the suspected leprosy cases to the PHC. She should administer the dose of MDT to the patients, and she should ensure regularity and completion of treatment. So without ensuring the completion and regularity of the treatment, there is no use of giving proper treatment to the clients. So the disease won't go from the client, again it will result in the reinfection. She should assist them in these self-care practices, and she should refer to the PHCs whenever it is required. She should assist the male health worker in maintaining the records, mainly for the patients who are having this malaria, tuberculosis and leprosy. She should administer oral rehydration solution to the diarrheal cases and refer the suspected cases of blindness and refer to the medical officer of PHC. Coming to the malaria responsibilities, she should identify the cases, she should explain them the immunization, she should take the blood smears, she should refer the seriously ill patients to the PHC for the immediate treatment. So she should provide treatment for the positive cases as per the drug policy, and she should maintain the records of blood smears that were collected and the patients that who were provided with this anti-malarial treatment. And she should adopt the universal precautions for to collect the blood smears, and she should ensure that the pregnant mothers or the pregnant women of endemic areas, they are receiving the insecticidal treatment and mosquito nets. Coming to the filarial endemic area related responsibilities, identification of lymphedema or hydrocele, and she should refer them to the PHC or CHC. She should train the patients with lymphedema or encephalitis on care of feet. So the patients who are having this lymphedema or encephalitis, as a ANM nurse, she should train them, she should explain them the care of feet, and she should train ASHA workers and community health guides mainly for mass drug distribution of this DEC plus albendazole on National Filarial Day. So you can also see same the Kala Azar endemic area job related responsibility. She should identify the patients who are having fever for more than 15 days. She should collect the history mainly about the migratory status of the family or guest during the last 3 months. She should ensure that the patient get the complete treatment. She should ensure that the patient are getting follow-up for the treatment. She should assist the male worker mainly in supervision of spray activities. In dengue and chikungunya also same. She should assist the people who have fever with rashes and joint pain, and she should refer those kind of cases mainly to the PHC. She should supervise the source of reduction activities during the anti-dengue month, and she is the one who coordinates the activities of village health sanitation and nutrition committee. She should create an awareness by health education with elimination of AIDS breeding and proper water storage practices, so that these mosquitoes won't grow and they do not cause any kind of dengue or chikungunya. Coming to the Japanese encephalitis area job related responsibilities, she should inquire the presence of fever with meningeal signs and refer them to the nearest PHC. She should conduct health education activities to create community awareness. Coming to the non-communicable disease related responsibilities. So not only in communicable diseases, in non-communicable diseases also, she should inform, she should educate, she should communicate, and she should conduct the prevention of early detection of harmful consequences of mainly tobacco or mental illness or iron deficiency disorders or diabetes or cerebrovascular diseases or the strokes. So she should create an awareness. She should conduct the surveys, she should identify, and she should send them to the PHC. She should conduct screening camps. She should sensitize the ASHA workers and Anganwadi workers about the non-communicable diseases. Not only to look after communicable diseases, they have to even look after non-communicable diseases. Identification and referral of care of common mental illness patients or epilepsy for the treatment, and greater participation or role of community for primary prevention of these non-communicable diseases. And she should promote the healthy lifestyle and promotion of healthy lifestyle to mainly to prevent the non-communicable diseases. Coming to the vital related job responsibilities, so she should record and report of all the vital events, including the birth as well as death, and mainly to the health authorities. Nextly, record keeping related job responsibilities. So maintenance of all records which were concerning the mothers, children and eligible couples. She should submit weekly and monthly reports to the health assistant female. Maintain passive surveillance register for the malaria cases and treatment of minor elements. So here she should treat if it is possible, or if not she should refer them to the nearest PHC. Coming to the team activities related job responsibilities. So she should attend the staff meetings at PHC level, at community development block, or both. She should coordinate her activities with the other health workers like health volunteers and ASHA workers and DAI. She should coordinate with the village health sanitation team as well as nutrition committee. She should draw village health plan with the help of health worker male village health sanitation committee, and she should dispose medical waste according to the guidelines. She should organize the village health plan days at Anganwadi centers. And finally, house to house survey related job responsibility. So she should conduct annual service, and she should take the help from male health worker and ASHA workers, Anganwadi workers and community volunteers, and sometimes even the panchayat members and village health sanitation nutrition committee. So thank you. So these are all the responsibilities of this ANM nurse in the community setting. So she has to go for house to house service, she has to participate in team activities, treatment of minor elements, record keeping, vital events, non-communicable disease related responsibilities, communicable diseases related responsibilities. So she has to take care all these things, and she has to participate in immunization program responsibilities, nutrition related responsibilities and medical termination of pregnancy responsibilities, family planning responsibilities, maternal and child health related responsibilities. So this is the job description for female health worker ANM. So if you like the content, please like, share and subscribe. If you have any queries, you can drop them in the comment box, and if you are not understanding, please let me know so that I can change my way of teaching. Thank you so much. Thanks for watching.